if there's anyone in the public that wants to comment. I don't know if we've had any come in yet via text or the chat box, but whoever joined us from the community, whether it's a hospital board member, a hospital staff member, or anyone from the community, thank you for joining us this evening. I take it there are no comments, Bridget?
Not yet.
Okay. All right. I think the first thing we need to do is to move on to our annual meeting. And let me open up the correct PDF here. We have a slate of officers that we would like to, in this case, re-elect. I threw my name. Yeah, John, go ahead.
We need to re-elect you as a board member before you move on to the slate.
Okay.
I think you're fired.
Request denied.
Oh, so for election of directors first. Okay. So is my term up then? Is that what you're saying? No one told me that.
I understand the agenda and the way Bridget's got it set up here. So somebody needs to make a motion to either run you off or to nominate you for re-election to the board of directors.
Okay.
I would like to nominate Thomas Rice to be
Hey, I already
on.
did that, Cody.
Oh, I'll second it then.
All right.
I didn't realize I had a choice. Now you tell me.
You don't, Tom. This is
All right. Okay. I can't call the vote, so Cody, you'll have to do that.
Yeah, we need to vote.
all in favor?
Aye.
Aye.
Wonderful.
Well, thank you for your blind faith in me. I appreciate that.
Hey, I always trust people who wear visors. That was what my nana taught me.
All right, good. Okay, that said, let's move on to the election of officers. I am willing to continue as the chair if I have the support of the board. I would also, but I can't nominate myself. I'd like to nominate Cody Burke as the vice chair, and as well as Dan Valverde as secretary treasurer. Do I hear a motion to at least address Cody and Dan's positions on the board?
I'll make a motion to approve Dan to the board as secretary treasurer.
And I make a motion to approve Cody to the board as vice chairman.
Okay.
And why doesn't one of you make a motion to Tom as chairperson?
That's mine. I would like to approve Tom because I love him.
I thought we already did that.
No, we
it's
just
on the-
voted him back on the board
Yeah.
because he was termed up, but now it's leadership position. So
Okay. All right. I'll abstain, but let's see. So do I hear a motion to approve, or do I hear a vote to approve Dan Valverde as secretary treasurer? Cody, you'll have to recuse.
I made
I'm
that
sorry.
motion on Dan.
Or,
He will need a second from someone.
Oh, I'm sorry. Thank you. Is there a second for Dan to remain the secretary treasurer? Do I hear a second?
So moved.
Okay. All those in favor?
Aye.
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 None opposed? Okay. Do I
Thank you.
hear a second for Cody's position as vice chair?
So moved.
Okay. All those in favor?
Aye.
Aye.
Okay. All right. Well, thank you, everybody.
Now you yourself,
Pardon?
you need a motion to approve you as chairperson.
I think someone else needs to do that.
I made the motion. We need a second on Tom as the chair.
Seems like this is the third time we've done this for Tom. I don't know.
Well, you know, he's an important person, so
Yeah.
third time's the charm.
Lots of
There you
different
go.
sides to him too. So
There you go. All right. There was a second. And then all in favor?
Aye.
aye.
Okay. All right. Well done. So it's 5:30. We are going to close the annual meeting and we're going to call to order the regular meeting at 5:30.
Okay.
Dean, it's all
Yeah.
yours, Dean.
So not a whole lot to report. We are in the bidding process for the maintenance equipment that we're looking to replace or repair. We're also in the process of going through our water line extension for irrigation. That's an ongoing process that we're trying to get finalized so we can get pricing on that to get done probably late winter, early spring. Other than that, I don't think I have a whole lot more to report unless anybody's got any questions for me.
No, don't. Have you been able to strike up the conversation with Keith again on the water line? I saw him back in, looks like he's back in town.
Yeah,
Okay.
we met with him. We kind of went over the route, how we're going to go through it. We're in the process of drafting a proposal for him.
On a later note, congratulations.
We expect to get that out next week or the week after here pretty soon to come to our board for approval to sew up what we need to continue that on. And then we'll put it out to bid to extend the water line from Keith's property.
Okay. All right. Any questions for Dean? You guys doing well, Dean? Hopefully everything's good.
Yeah, it's
Okay.
all good.
Okay. Well, thanks, Dean. Are you gonna?
Dean, how's everybody on MCHD board? Health as well? Everybody's staying safe, hopefully?
As far as I know, everybody's doing good. Yeah,
Okay, good.
I appreciate that, Cody. Yeah, I think we're all doing good. So just
Okay, we'll keep going then.
yeah, trying to get through it all. So
Cool. All right. Good to hear.
Good.
Yeah.
All right. On to CHC report. Who was doing the pharmacy update?
Craig is just coming on. Give him just a second.
Okay.
He will that's just to review. I don't think anyone will be giving a verbal report on that, but
Okay.
Craig will be here to talk from a CHC perspective. I just admitted him.
All right.
I'm here.
Tom, there's a lady that we work with at CHC and Materials, and she's a pharmacist, and she does a lot of good work and discussions with us. I think her name's Amanda Sherrod.
Okay.
Yeah, that's right, Rick. Yeah, I'm here, Tom.
All yours, Craig. How are you?
I'm good, thank you. Sorry, I had the wrong information. I just my report is as submitted. From that standpoint, our real focus has been, and I want to congratulate the team at Southwest as well in regards to the rollout of the vaccine. I know y'all got your first doses today. Several of our hospitals are still waiting for it. There's a lot of misinformation out there that we're trying to dispel in regards to the efficacy and the safety of the vaccine. Just in kind of random polls with our employees, there's been about 40% who had indicated they may not want to take the vaccine, and we're encouraging everybody to do that, but it is their choice on that. So kind of interesting to hear about that, but we're trying to help the hospitals with the rollout plans as well on that. But really, that's my report. I know Tony's got the business plan, the budget tonight, and we've got some things in executive session to talk about. I'll be happy to answer any questions that the board may have.
I have a question related to vaccination. I know that we had issues like the refrigerant, the refrigeration unit, I don't think came with, and I know that we have a unit for grafts and things like that. Was it able to store the vaccine at the correct temperature?
I can answer that. The issue is not the refrigeration unit at the hospital. The issue is that Durango does not have a refrigerated truck that can transport at 90 degrees below. So technically it's shipped on dry ice, but it's starting to unfreeze or starting to thaw by the time it gets here. That's why we're in a 72-hour window. We're trying to figure out a refrigeration truck. I asked Mark Meyer that, and Jade covered it on our employee forum this afternoon.
Is our unit that we have for surgery that
yes
takes our biologics, would that cool down enough to?
Yes. Talked to Karen and Mark Meyer about that, but I think our vaccination freezer will be here, if not tomorrow, then by Friday. Is that correct?
It's the 28th. It's been delayed a little bit.
Okay.
But we do have dry ice to be able to transport between Durango and here until that time. But we do have 72 hours to use it once we get the vaccination.
Karen, do we know what? Yeah, is that shelf life, Karen, is 72?
That's from the time it arrives because it starts thawing. And so the first doses arrive, we have 72 hours to administer the entire batch.
Cool. I'm excited to see tomorrow. So
actually, Kelsey told me today that is now 120 hours.
What was that, Tony?
It's actually 120 hours now.
Oh, that's even better.
Yeah.
Yeah, I had heard 5 days, Tony, too.
So
yes.
Are we dry icing or are we keeping in our surgery refrigerant unit?
Dry icing, pelleted dry ice. It has to be.
I actually think the surgery unit is too cold. There's a very small range it has to be in.
Mm-hmm.
And I think the one that you all use for the grafts is actually too cold.
Okay, good to know. All
so
right.
we had ordered the freezer unit. We just had not gotten it yet. I was under the assumption we already had it. Okay.
Yeah, I think there was some delays on part of that when it came to actually logistics of moving the unit. So. And
then the transportation, you can't. I mean, obviously, you can't run it off a generator on a transport truck or something like that. Or at least they're transporting on ice even to Durango, on dry ice even to Durango. I take it. Then.
Okay. Right. It has to be at 80 below centigrade. So there's not a truck available between Durango and us that will do that. But if we are able to pack it in dry ice in Durango, which did we figure out we could do that, Karen?
Yes, we were able to get 25 pounds of dry ice, from what I understand, to be able to package and transport.
So that way, that'll extend that period because we won't lose that time as soon as it is offloaded in Durango.
So obviously, there's a lot of logistics as this whole thing starts to unfold. Is the state? I mean, transportation is part of the logistics. Is the state? How are we dealing with as a state? Because I guess they're sort of doling out the available vaccinations, but as we get more and more vaccinations, is there someone or an organization within the state that's starting to handle these type of logistical problems, or are we adapting as we go?
We'll be adapting as we go.
Okay.
Just because we know the game changes almost daily, and what we get, we get it. So.
Okay. Interesting. Okay.
Aaron, do we know how many Southwest Health employees have elected to receive the vaccine?
I think it was about 51%. There was 200, almost 300, 258, 260 that had elected to get it. So, which we thought was a pretty good number. We were expecting around 50%.
Okay. Could be better, but I'll take it.
We'll have to work on them, I guess. All right. Science. There you go. All right. Well, thank you. It's pretty interesting to see how this is all rolling out. Anything else from CHC as far as the monthly report?
Not unless there's any questions, Tom.
Okay. All right. Thank you. Appreciate it. All right. On to quality.
Hi, everybody. This is Lisa. Hope you're doing well. For this month, I really just wanted to go over a few things that quality works on that maybe you're not aware of. So Bridget, you can go to the next slide. What we do is, obviously we report metrics to CMS, but we also do dashboards with quality health indicators that go to our program for MBQuip that we work with for grant money. But it also helps us track our numbers and where we are just as a quality hospital. So I did want to share these numbers with you. As far as healthcare infections, we really are doing fantastic. We did have one through this year, but we are still well below the national standard. You can see on unassisted patient falls, obviously we look at all falls, and we've gone up and down through the year from our goal of 0.4%. We've averaged anywhere from 0.7 to 2.4% and down. So this is why Falls has been a performance improvement project through this year. Our readmissions are on the low side, but we do look at those and also do chart reviews on anything within 72 hours just to make sure that we are doing the best patient care that we can. And then left without being seen and inappropriate emergency department utilization is something we look at as well to see if maybe we need to do different things for our patients on discharge for that. So I just wanted to make you aware of where we are with numbers in those areas. So overall, our patient falls is one of those things that has really stood out through this year. Bridget, you can go to the next slide. So with patient falls has been another performance improvement project. I've talked about it through the year as far as sepsis. I wanted to share this spreadsheet because it really does show where we've slowly started to meet all of those sepsis metrics that we've wanted to. You can see in the beginning where you have all of the yeses for initial lactic. So those are blood draws that we want to be doing initially when that patient comes in and presents with sepsis because, you know, touching these patients quickly, doing all of the right things early really is the best patient care and saves lives. So through this year, we've actually improved with those labs draws, early antibiotic administrations, which we still fell out on 2 of those. So obviously we're still working on those. We drew blood cultures on everybody. So this just shows how we're still working on it. It's still a metric that we want to touch this next year as well. Really to be our goal to treat all of these sepsis patients early for their treatment. Next slide. And then as far as falls, again, you know, I showed it in the first slide, but I really have to give it to the inpatient unit. Megan, our inpatient director, and Karen, they've really implemented such good education as far as policies and training to staff. Our fall policy and training went out in health streams to clinical staff as well as registration, EVS, other people that really touch our patients that can help with falls. They've initiated falling star signs on doors. That's a standard trigger for anybody in the hospital walking through to say, oh, this patient's trying to get out of bed, but they have a falling star sign. What can I do? So really just trying to touch back to a culture of everybody is part of our patient care and how can we prevent falls, but how can we really touch the patient with everybody as a culture of patient safety. Next slide. And then I just wanted to share that we did start a quality newsletter monthly. I did want to just keep it bullet pointed, just quick information. I know it's really hard right now, especially with being overloaded with things to read, things to, you know, as far as emails, but just trying to share as much information as I can. It's really hard when, you know, staff are focused on such a pandemic and things, but still trying to drive home what quality is, what we're doing. So just bullet pointed on those newsletters, what policies we've updated. They can click on that, link to that policy, and just a quick reference. So that's within our intranet, just like the COVID site is. So I just wanted to share that this newsletter was implemented this year as well. And I think that was it. Did anybody have any questions for me?
I do not.
Okay.
My only question,
well, thank you all.
Lisa, in June, what was it? Lisa, can you hear me?
Yes, I can.
Lisa, cool. What was it in June that was driving the fall rate?
You know, we honestly had one patient that fell multiple times.
It was multiple times. Okay, that's what I was wondering.
Yeah,
I thought it might have been.
Unfortunately, yeah. Mm-hmm.
Yeah, non-compliance is hard to control.
It is. There's always those factors that you just try your best with. So.
Okay, any other questions? Karen, do you have anything?
No, I did want to share that we had made a few changes in some of the patient flow recently. we, outside of the fishbowl, which is where we had our waiting room for the lab and ED patients, we did change that so that the lab patients are now separated from the ED patients, since potentially there could be patients who are sitting waiting to be seen in the ED. So we have changed that flow a little bit just to help to move patients through and keep the flow well. So I just really want to shout out to the ED and the inpatient units for really, really pulling it together. And the other thing I wanted to share is that we had put out a list of 138 needs that we had for either being on call or being a secondary person to help the inpatient unit. And within 24 hours, we had almost every one of those shifts filled, from people in the clinic, from people in the EMS, from the inpatient side. You know, everybody is just really pulling together to make it happen. And it's just really heartwarming to know how much we're working together to take care of our patients and each other.
Now that's what a good deep bench that you have there that are willing to step up to the plate.
Absolutely.
Well, it's not often that your quality director is working the COVID floor. Thanks, Lisa.
Yeah.
I texted today about
Man, I got to give it
doing
to
some
those nurses.
tech work, and you're talking about a group of people who have been stretched about as thin as can be, and yet they're still volunteering. I don't know.
Yeah.
You got more resolve than I'll tell you that. We're blessed to have that group of people at our institution. So thank you guys for your leadership and for somehow motivating people to do more than they should be doing.
You know, and I don't know what we can do in our community other than what we are already doing to try and get the word out there about just the degree that people are, the level people are working at, you know, just as a tool to tell people to pay attention to this true problem that we have. But I don't know, it's all over the media about what healthcare workers are doing, and it doesn't tend to change people's attitudes or what they're doing. So.
I think, you know, in the last Facebook Live we did, I didn't get to this answer, but, you know, Mark's question was, what is one of your biggest fears? And, you know, the inpatient director and I was talking about that if we're so full with COVID, what if somebody comes in with a heart attack and we have no space for anyone else? And those people that aren't COVID positive, you know, could be impacted by this as well. And it's very scary.
Yeah, it's a hard lesson to teach people when it's not directly impacting them, is it? Okay. All right. Well, thanks, Karen and Lisa. Anything else from you two or questions?
I don't think so. Thank you.
Okay. All right. Thank you. Great job. All right, Rick, on to you, man.
Hey, thank you. So wanted to show everybody basically our package that gives our proposed 2021 budget. I know Craig's still on the line, and we did a budget review, you know, with the CHC team. We've spent some time, you know, looking and re-looking and viewing and reviewing numbers and making the changes. So I'd say probably the change that came out of Finance Committee is we're looking from the other revenue standpoint. We looked at some of the CARES Act money that we're probably going to realize in the first 6 or 7 months of 2021. And that's CARES Act money that was distributed in fiscal year 2020. So we modified the budget to other revenue, and that went up about $1 million. You know, all things being equal, you know, we've seen fairly strong volumes through the last few months of the year, and you know, so we projected out, you know, what we're going to do in terms of this year, ending at about 121 million of gross. So we made some reasonable budget assumptions that we're going to be able to you know, provide health care throughout the community, you know, just outside of COVID. And so, you know, we're pretty anxious and excited about the results that the vaccine's going to show. So having said that, we looked at our volumes. We know we have some providers that are going to be coming on board. I think Tony's going to cover that we've got budgeted for in Q3 and Q4 of next year. they're going to drive some of the clinic volumes. And then we looked at where we're impacting salary dollars and things like that, and looking at supplies and staying within about 15.1% of net revenue for supplies. So came up with a budget of about $64,515,000 of net revenues. We're looking at total operating expenses of being about 68 million, slightly over 68 million, 6,000, and then non-operating revenues of about $2.19 million. So that gives us a net revenue over expense of a slight loss of about 1.3, but gives us an EBITDA margin of 4.7. If you want to take out where we are on non-operating income, if you want to back depreciation out of that, we're at basically slightly over $1 million, $1,034,000. And then if you add the non-operating revenues to that, we're going to be at slightly over 3.2. So wanted to see if you guys had any questions on the operating revenues, net revenues, operating expenses, non-operating expenses, how we got to EBITDA and things like that.
Okay.
No, it looks good, Rick.
Thank you. I know I'd say our next tab is what we're looking at from a capital budget perspective. The only change from Finance Committee, we spent a little bit of time with Matt Lindsay, who is one of our EMS directors. And what Matt did is Matt is very strong at writing emergency grants. And he believes that we can write a grant for an ambulance, and an ambulance goes for about $240,000. So we're thinking the ambulance grant Matt will be able to write to the state will be $240. Half of the ambulance is paid through the grant, the other half is paid by us. We do have some equipment of this high dollar that's aging out, and it's our RX stations, and these are pharmacy stations that we utilize to try to control the dispensing of drugs. It's where they can be stocked, and they're stocked by our pharmacists. We also have controlled substances that are in there that has a special code that you have to get through. In fact, we're even adding an anesthesia one for surgery. So those are at end of life, and those stations are they'll be about 20 years old when we replace them. We're looking at replacing them in Q1 or 2Q of 2021. And also we have an angioflora room it's 20 years old, so that needs to be replaced as well and that's GE. So the Cerner integrates well with our system. The angioflora room is a GE, and it's on contract. We also have some OR surgical tables that are at pretty much at end of life, so we need to purchase one for that. We also have a GI scopes through processor, the ambulances we talked about, and then miscellaneous equipment that could range from anything dealing with surgery or as easy as a BiPAP machine or something like that, depending on how we on what kind of issues we're seeing with. So the capital requests are about 1.32, some of which we will probably look through a financing arrangement where either the lease whether we own it at the end of the lease or purchase it outright for $1. And then some of the other pieces will be made through operating capital. We are looking at financing the Cerner stations as well as the angioflora room. And that'll be financing, and we'll bring those recommendations through Finance Committee as we solicit bids. And who knows, we may end up getting both of those underwritten by Vector Zions Bank. So didn't know if y'all had any questions on related to capital. Also, if things do break, we'll bring it back to you guys from a capital standpoint, saying, hey, our so-and-so broke. I don't want to name a name because I don't want to tempt fate, because it's still 2020. Um, so just wanted to share that with you guys as well. And see if there's any capital equipment questions.
And none of that, no, never mind. Go ahead, I got it.
John or Tom, John, Dan, with permission, I think we have 3 resolutions for the budget, 2021 budget, as well as the capital related to the revenues.
Do we, yeah,
The
do you want,
expenses,
go ahead.
and the expenses. So if you guys want to entertain and pass those now.
Yeah, let me scroll down to those. I thought we had them in the package, but I'm not.
Bridget, are they in the package?
I thought where did I see those? No, they're not in the package.
Rick, I was wondering why you had a ceiling fan on, but then I realized you're in Florida.
Thank you, Cody. I appreciate you.
I was like, what in the world is
I appreciate you betraying me to witness protection, so thanks.
Yeah, no worries.
I don't see those. I don't see those
Bridget?
resolutions.
There, I just shared it.
Okay, let me go back to that. Okay, thank you. Sorry about that. All right.
My bad.
No, you're cool. Do I hear a resolution? I'm sorry. Do I hear a motion to adopt resolution 2020-03, the budget adoption resolution?
Oh, yeah, that one 2020.43. Yeah, I'll make that motion.
2020.03. Yeah. Okay. Is there a second?
Mm-hmm.
I second.
All those in favor?
Aye.
Aye.
None opposed. Note that that is a bigger budget than Montezuma County runs. So blows me away. Okay. All right.
I also want to just thank Rick and the team for all their hard work and effort on the budget. Tony and them did a great job on the review, and there wasn't a whole lot of questions in that regard, but they did a very good job.
Yeah.
Thank you.
And then do I hear a motion to approve resolution 2020-04?
That's to appropriate the money to fund the budget.
I'll make a motion.
I so move.
All those in favor?
Aye.
Aye.
None opposed? Okay. All right. I got to back up. When we didn't approve October financials. Let me back up one step. Do I hear a motion to approve the October financials as recommended by the Finance Committee?
I so move.
Second?
I'll second.
All those in favor?
Aye.
Aye.
None opposed. Okay. Moving onward. Capital expenditures. Go ahead.
Yeah. Tom, the other things in the operating, and I think Finance Committee approved is we're looking at a 3% increase for employee salaries, and then a 2% 403B match as well. And I wasn't sure if there need to be a resolution on those.
I don't know. I think there does.
Yes.
Yes.
Yeah.
Do I hear a motion to approve a 3% increase for hospital staff as recommended by the
So moved.
board, by the Finance Committee? Is there a second?
Second.
All those in favor?
Aye.
Unopposed? Okay. And then it was a 2% increase, 2% match for
It
the
was a 2%
403B
match.
for the 403B
I'll make a
program.
motion to approve.
Okay. Is there a second?
Second.
All those in favor?
Aye.
Aye.
Any opposed? Okay. All right. Line of credit agreement we're going to discuss. I think we need to do that in executive. Is that correct?
It's in the executive packet. I didn't know if there was going to be discussion or, so I have it both.
I defer to you, John. Do we discuss that in the executive session or do we discuss that here? Does it matter?
Let's do it in executive.
Okay. Anything else for Rick on finance? Rick, did we miss anything?
Not for the budget, sir. Just if you want to hit the October results, I can briefly kind of walk you through that.
Yeah, please.
Just
Okay.
so I don't have any notation of the capital expenditures.
Oh, sorry.
That's okay.
Well,
Oh, you needed a.
consider, and you need a motion to approve the capital expenditures.
Oh, sorry. Okay. I thought we did that. Do I hear a motion to approve the capital expenditures as recommended by the committee?
So moved.
Is there a second?
Second.
Hey, all those in favor?
Aye.
Okay, none, any opposed? Okay. All right, Rick, back to you.
Okay, for October, again, strong pace in cash collections. Again, it's been habitual to be over $5.4 million. We did increase our operating cash by almost 200K. We did show a slight market loss in investments. In our gross AR, again, if you we were collecting it, so it decreased by about 300K. We did see a net revenue increase. Other non-patient AR did decrease by about 20,000, so that's forgiveness. Yeah, we paid down our AP by about $430,000. We did record a take back. We did receive a 2016 cost report letter from our friends at Medicaid, saying that they were taking back about $520,000. That's probably the fourth letter that we've seen from Medicaid recouping some cash. I think the total amount, not counting credit balances, that Medicaid is looking to recoup is about $2.6 million. We had, probably when Tony and I walked in, we had about over $2 million of credit balances. Now Medicaid credit balances are down to about 800,000. We've kind of hacked through that. So just kind of keeping you updated. We are reopening the Medicare cost reports that may give us some argument with our friends at the state regarding some of the Medicaid takebacks. But again, these are some sins of the past that we've encountered from 2014 through 2016. It's not fun, but hey, we're persevering and we're going to fix it. From revenue over expense, we were under 33,000. However, our year to date is almost $750,000. Our EBITDA for October was over $500,000, and year to date EBITDA approved to $5.8 million. So we're ahead of our EBITDA budget through October by about $850,000. Our November results will be shared tomorrow at our finance committee meeting, and then we will share our November and December results in January. We did see our provider salaries above budget and our staff salaries. We budgeted lower numbers in November and December. God bless you. God bless you. So hitting our volumes, we did have a question saying, why did our salaries go up? Well, we didn't expect the volumes that we encountered. So we always try to budget the fourth quarter a little lighter based on the fact that there's tremendous amount of holidays and things like that in there. Benefits, again, came out below budget. We did anticipate the stop loss checks coming back, and we received those yesterday, and they were $203,000. Medical specialist fees, and that deals with some of the docs that we have with Dennis Lewis and then some of the other physicians on committees. Purchase services, this is something that basically will shock you. We've seen invoices coming from Quest Labs of $80,000, and then our last invoice was $160,000, primarily due to some of the COVID screening that we're doing. And that's it's pretty alarming.
Whoa.
Supplies above budget by about $118,000. Again, part of that's due to joint replacement, and part of that's some of the drugs and things like that we purchase for our hospital. We did fill about 4,000 retail prescriptions So that's, I mean, our retail pharmacy is incredibly busy. It's a convenience for our patients. Interest expense again came in right at about what we thought it would based on the depreciation or based on the amortization schedule. Depreciation was calculated based on the HA guidelines, and our donations was $164,000, and that was our sales tax. So again, thank you to the residents of Montezuma County for passing that. Any questions on our narrative?
I have none.
No.
Shirley?
No,
Okay.
I don't.
Susan?
No.
Okay. Our narrative was prepared from our balance sheet and income statement. As you can tell and I'm on page 9, this is our debt service schedule. So MCHD contributed about $1.35 million towards our bond payment, and the hospitals through operations is about 1.6. Okay. Kind of going forward, we ended the month of October at 101 days cash on hand. We're currently at about 95 days cash on hand. We're projecting to end the year right around 90. And again, giving you guys fair warning, December is a 3 payroll period month. So because we're going to pay people on New Year's Eve instead of the 1st, it's also another anomaly, and that the employees will get 27 checks, physical checks or direct deposits in there, which happens probably every, I don't know, 8 to 10 years. Go ahead. Sorry.
Nope, I just didn't realize it was every 10 years. That's fine.
I think so, basically because it recycles to every Friday.
Mm-hmm.
We pay people out on every Friday, because the Friday's January 1st, we're paying people on Thursday.
Okay.
Okay. Our statistics again, pretty strong from average daily census of about 8 patients, even though we budgeted, around 9. You're going to see that number go up for definitely for December. We're hitting our ratios again. So we're hitting all the ratios in our bond covenants. We should be able to come out of forbearance probably Q1 or 2Q of 2021. Mr. Brooks, please correct me if I misspoke.
Nope, I'm hopeful, and I think Tony and Rick have done a good enough job to get us there.
Yeah, thank you. Statement of cash flows, and again, we have some rounding errors, but our rounding issues here. But again, cash and cash equivalents. Then this is our sources and uses of cash and what we paid and where things were expensed and such. So that's where we are. Our next page is our report card, page 15, and we're zipping along at a pretty good pace for business office metrics. And these are things that we walk through with CHC. So that's my report, and if you guys have any questions or comments.
Nope, I have none. Thank you.
None.
I enjoyed it thoroughly. Good job, guys. It's pretty impressive what we've done in the 2 years or so that you guys have been kicking ass. So strong work. It's pretty impressive.
Yeah, thank you. Yeah, like I said, when Tony got here and came here with CHC, I mean, Tony's been here almost 3 years. I've been here over 2. And like I said, Tony had black hair when he got here. And I had, I still pretty much look the same, but yeah.
You both look good.
Thank you.
You haven't aged a minute.
Like that.
Yes, we have, but thank you for saying.
I think we all have.
Tony, I don't know if you have any other comments about that.
I do not. You covered it very well.
Or defense, one of the two. Okay. All right. Thanks, Rick. Any more questions for Rick? Okay. Tony, it's all yours.
All right. Obviously, we're going to talk about a few things in the executive session, like the business plan and some things along those lines. But just overall, we continue the battle with managing the COVID situation. Been a pretty tough week. We actually had, I think this is right, Karen, 23 patients in the hospital today. And I believe 11 of those were COVID, 10 or 11 still around there. So we're seeing a pretty healthy volumes in our inpatient side. And the number of percentage of our patients that are COVID related continues to grow. So I've been in some discussions with the state trying to understand the numbers the state are reporting as far as positivity and what we're seeing locally as positivity, and trying to reconcile that. And we're not quite there yet. They're basically showing a whole lot more tests being done than we're showing locally, and I have no idea where those tests are coming from, as we're doing most of the testing at the hospital. So,
and that's
in that discussion. So
that's influencing the positive rate, inflating it, or
it's well, I mean, the state is showing on their website that as of today, the rate was 11.4% for the last 2 weeks. And if you look at the county numbers, it was better than 35%. So it's not just a little off. I mean, it is majorly off. And they're showing, like I said, they're showing about 3 times the number of tests being completed than the county is showing. And we know they're capturing that data, and we're doing most of the tests. So it just doesn't make sense. Something just doesn't quite pass the smell test. And so I'm trying to understand what's going on with that, because those numbers are being used very frequently locally and if we don't have accurate numbers, it's hard to make good decisions on what's going on. So continuing to do that. So, Carrie's not here tonight. I will tell you a couple of things. We do have made some progress on signing a couple of positions. We have a OBGYN and surgeon that have signed letters of intent. We're pretty close on getting contracts wrapped up with them. And we expect they'll be signing their actual official contract. They'll come back to you all for approval probably later this month. Probably approved in January, is my guess. But fills a big gap that we needed there. So that certainly goes a long way in helping us fill those needs that we're going to be having going forward. They would not actually be here until October 1st of next year. They're both finishing up their last year of residency. So we'll but again, it's the light at the end of the tunnel for both of those areas, getting those firmed up. We've actually had some discussions with a couple other surgeons, a husband and wife team that are going to come here. We're just trying to figure out if we can justify the need for them at this point, because but we're still kind of having those discussions anyway, and trying to figure out if there's something we can do creative to maybe expand outreach or something in that area that we could utilize 2 more surgeons on our staff. So we'll see how those discussions go and let you know how that goes as we move on. Otherwise, I'll just open it up with any questions you might have. And like I said, we'll talk about some more things in executive session when we get there. Tom, you're muted.
Sorry, I appreciate the message that you posted. It was a little bit sobering, but I think it was a good, strong message to put out on Facebook last night. So,
yeah. One other thing I will tell you about, we had a very good conversation with our commissioner-elect Lindsay today. We had about a 30-minute conversation with him just to try to get on board, try to get his perspective or some kind of see what his expectation is. He was very open to discussions. We had a lot of discussion about the vaccine and being able to promote that. He's definitely going to be an asset for us from that stance. So we're very glad to hear that. And so we'll again, I think we'll at least get started off on the right foot with as we move into the new year with commissioners. And I told him we very much wanted to do that, make sure we had a good relationship, and I think it would be to everyone's benefit if we were able to do that, and he certainly agreed with that. So that was a good conversation.
So
Yeah.
Tony,
Yeah.
who was it that you talked to? Which commissioner?
Kent Lindsay, that
Okay.
he'll be coming on in January.
And so will Joe Stevenson.
Correct, yeah. Have you reached out to Joel, or did Kent reach out to you first?
We actually reached out to Kent, and we have reached out to Joel. I don't believe, Bridget, I don't think we have anything scheduled with him yet.
That's correct. He has not responded. I was going to give him another day or so and then reach out again.
Okay.
Good. Okay, great. All right. I don't have anything else, Tony. Thank you. Great job.
All right. Thank you very much.
All right. Okay, we need to approve some minutes. Do I hear a motion to approve the October 28 meeting minutes?
I'll make a motion.
Second?
Second.
All those in favor?
Aye.
Aye.
None opposed. All right, it's 6:15. Let's adjourn from our regular meeting into executive session. Everybody, let's take a quick 5-minute break. And then I'm sorry, Bridget, are we switching to a different platform? I can't remember.
I think I can continue on this. Let me see if